Everybody, you're very welcome on this beautiful summer's evening to the UCD Institute of Food and Health public lecture. These lecture series are designed to give you, the public, access to expert information in the areas of food and health of interest to you. And tonight we have the important topic of nutrition and men's health. So I'm delighted to welcome Professor Clare Corish. So Clare is professor at the School of Public Health, Physiotherapy and Sports Science here at UCD. And Clare's expertise is in human nutrition and dietetics. She has extensive experience in dietetics practice in Ireland, the UK and Saudi Arabia, spanning over 15 years. And now she's involved in teaching and research in clinical nutrition in her role as a lecturer in human nutrition and dietetics. She does a lot of outreach work, having been a member of the Food Safety Authority of Ireland Public Health Nutrition Subcommittee for over 9 years and serves on a number of expert committees. So over to you, Clare, and delighted to have you here this evening and looking forward to hearing your talk. Perhaps just before Clare gets started, to remind you that we will take questions and answers at the end. So if you could place your questions in the Q&A tab, and then my colleague Lorraine Brennan will moderate the questions, and hopefully Clare will get around to answering as many as she can. So over to you, Clare. Thank you very much.
Thank you very much, Dolores, and thank you to the Institute of Food and Health in UCD for inviting me to give this talk. So this is the first day of International Men's Health Week, which runs until Father's Day next Sunday, and that is an international health week in Europe, in Australia, in the US, in Canada, and again it seeks to highlight the importance of health, of men's health. So the focus from me tonight will be really on nutrition and men's health. And I will just try and move my slides now, which were moving beautifully a minute ago and are not moving now. Oh, now, okay, perfect. So what I will really talk about tonight and discuss in a little bit is the nutritional status and what we know about nutritional intakes of men living in Ireland, a little bit about nutrition and cardiovascular disease and prostate cancer, a little bit about male fertility, and I suppose how important it is then to maintain a healthy body weight, engage in physical activity, and I'll touch off a little bit about smoking and alcohol. So oftentimes when we look at nutrition and men in the media, we see an enormous amount of, bodybuilding, emphasis on protein supplements, on sport, on men being able to do lots and lots of different tasks all at the same time. But really, I suppose the focus for a lot of the media is that men have the perfect body, the perfect shape, are able to do everything. Whereas we know, in fact, that men, like women, actually are trying to keep it all together, are multitasking, they're trying to work, they're trying to stay a little bit active, they're trying to keep the money together, they're trying to maintain family, and oftentimes they put on a little bit of weight, they get a little bit of, heart problems, they find it a little bit difficult to deal with things, and sometimes they just go and have a few pints. So I think, in terms of what we see in the media portrayed for men's health and the reality can be quite different. And I suppose the statistics show that compared to women, men have a shorter life expectancy and a higher death rate at all ages from all causes. And that these strong male stereotypes can leave men more likely to be exposed to illness and dangerous circumstances, in that they are more inclined to take risks, less inclined to seek out medical advice in relation to their health and other things. So we know that men are less likely to access and use health information, that they are more likely to engage in negative health and dietary behaviours than women, that oftentimes healthier lifestyle interventions can be perceived as more feminine or more appropriate or, more pertinent or relevant to females. But we do know that men, when they have a health scare or have a health diagnosis, are actually more are able and more likely to pursue healthier lifestyles. So they're actually will if they have a health scare or they have a health diagnosis, they will change their lifestyle, and they're also better at adhering to more healthier lifestyles once they've made that choice than females are. So we look at the typical diet of males in Ireland. There are key nutrients that are, I suppose, of interest or problematic, really. The most recent data in Ireland comes from the National Nutrition Surveys, which the data were collected over 10 years ago now, but there is a current survey collecting the data again. So in another year or so, we'll have more updated information. But really, I suppose the key nutrients that we know about that are problematic are dietary fiber, vitamin D, saturated fat, and salt intakes. So we know that Irish men don't take enough dietary fiber, enough vitamin D, that they take too much saturated fat, and they take too much salt. So if we just look at those a little bit individually, first of all. So we know that dietary fiber is really important for healthy digestion and overall health. We know that the recommended intake of dietary fiber is about 25 grams per day. We know that fiber is divided into two different types of fiber. The soluble fiber, which is actually better for sort of our heart health, our sort of risk of cardiovascular disease, our risk of diabetes, that the soluble fiber is the most important. And that fiber is the fiber that comes generally from beans, lentils, vegetables, potatoes, berries, bananas, fruit, oats is a very good source. And then the insoluble fiber, which is the fiber that is really important for healthy digestion, which predominantly comes from wholemeal breads, high fiber breakfast cereals, potatoes, nuts and seeds, and vegetables and fruits with their skins and pips. But we know from the Irish data that men do not eat sufficient dietary fiber. So even those younger men who have quite a high energy, eat quite a lot of energy, quite a lot of food, total food, that their dietary fiber intake is only about 21 grams per day versus the 25 grams that is recommended. And that for those who are older, that the dietary fiber intake is lower again, so less than 20 grams. And in fact, as we get older, it's even more important that we have sufficient dietary fiber, because the muscles in our bodies don't work quite as efficiently as they do when we're younger. And that includes the muscles in our heart and the muscles in our gut as well, in our GI tract. We know that the main contributors to dietary fiber for the Irish population, for the Irish male population, is breads, okay, different types of breads, both wholemeal, whole grain, and white bread, because even white bread does contain some dietary fiber. Potatoes are a really good source, vegetables, juice, and then cereals. So I suppose the emphasis really should be that if breads are a good contributor and potatoes are a good contributor, that we should try and use the whole grain breads, the wholemeal breads, and we should try and use potatoes, particularly if they can be cooked with their skins on and eaten with their skins on. And we know that inadequate intake of dietary fiber can increase the risk of heart disease, type 2 diabetes, and bowel or colon cancer. And that particularly as we get older, dietary fiber is really important because people are at higher risk and more likely to develop constipation, which again can affect quality of life, affects appetite. If you're constipated, it's really hard to eat sufficient, and also increases the risk of colon or bowel cancer, large bowel cancer. And when we look at easy ways of trying to achieve a dietary fiber intake that meets the recommendations, an average size bowl of porridge in the mornings can be really good. or that can be replaced with, you know, a whole grain cereal. And then if we add some fruit like raspberries or banana or apple to it, that increases the dietary fiber. If we have our snacks as fruit, that was really useful. And then foods like baked potato with skin, baked beans, sweet corn are all really useful and easy to get sources of dietary fiber. Again, if we, for dinner times, you know, like pastas that are whole grain or our potatoes, as I say, are really useful, but also would have vegetables. And also it's really important with each meal to have a source of protein. So that source of protein can be animal protein, a small portion of animal protein, or we should also try and have mixed in with that some vegetable protein. So like beans, pulses, lentils are really good sources of protein, but also really good sources of dietary fiber. And then for snacks like wholemeal bread, peanut butter are all excellent sources. So it needs this sort of a mix of fruit, vegetables, whole grains, pulses, a mix of animal protein and vegetable proteins on a daily basis that really contribute to our dietary fiber intakes. The second problematic vitamin is vitamin D, and we know that vitamin D is a fat-soluble vitamin which is needed to absorb calcium. So it's needed for healthy bones, but it also, you know, is importantly recognized or increasingly recognized to have to be important for overall health, so for immune function in particular. And we know that both younger and older men in Ireland don't have adequate vitamin D. We know that the main sources of vitamin D are sunlight, but that is really problematic in Ireland between October and March. Now, the last few weeks, it's been brilliant. We've had such lovely weather and people have been able to get out in the sunshine. And obviously, you have to be careful about skin cancer, but you know, sunlight does have a really good effect. It converts the cholecalciferol in the skin to the active form of vitamin D. There are foods naturally rich in vitamin D, and these include oily fish and eggs, but Irish people don't eat a lot of those. And there are foods that are fortified with vitamin D. For example, some of the spreads are fortified, some of the milks are fortified, and some of the breakfast cereals are fortified. However, the Department of Health in Ireland does make a very specific recommendation that all Irish people, to be honest, whether they're female or male, aged 5 to 65 years, should take a supplement of 10 micrograms of vitamin D between October and March because of the normal lack of sunlight. And even when there is sunlight in Ireland, or if we get some sunny days, because of the latitude of Ireland, the strength of the sun is not actually able to convert the vitamin D into the active form of the vitamin D in skin. The other problematic nutrient or element within the diet is salt, okay? And we know that the recommendations for salt should be about 4 to 6 grams of salt per day, but certainly not more than 6 grams. And for Irish men, when you look at the nutritional survey data, whether they're younger men or older men, they're taking more than they should. So older men a little bit less, but still over 7 grams per day, and younger men 8.5 grams per day is the average. And the main contributors there are meat and fish, breads, soups and sauces. So you might think, how can meat and fish be a source of salt? But it is a source of salt if we eat a lot of pre-prepared and ready-made source of meat. So again, the important thing is to try and use fresh portions of fresh meat, fresh fish, frozen is fine as well, as much as possible. Breads, there's a lot of work being done within industry, within the bread industry, and they are reducing the amount of salt in bread. And soups and sauces, again, there is work being done with industry to try and reduce the amount of salt added to soups and sauces. So hopefully, you know, the next survey will show that there is a reduction there. But we do know that excess salt can lead to high blood pressure, and high blood pressure is one of the main contributors to cardiovascular disease. So the key points really here are to try and reduce ready-made meals, fast food, processed meats and salty, savory snacks, packet sauces and gravies, and try and instead flavor fresh food, so fresh meat, fresh fish, fresh vegetables, your peas, beans, pulses, with a variety of herbs and spices. And all herbs and other spices that don't contain salt are really useful and make food tasty. And fresh food itself, if it's fresh, obviously tastes really tasty. So again, there's just a few swaps here. You know, tinned soup can, if it can be made homemade soup, whether it's, you know, meat or chicken and vegetables, fried or battered into a fish dish with fresh fish, crisps to unsalted popcorn, ham and cheese sandwich with crisps into a chicken sandwich with fruit and say maybe some salad, bacon roll into an egg roll, and then the sugary high salt breakfast cereals into your whole grain breakfast cereals or your porridge. And there's really nice information on how to reduce salt on the Irish Heart Foundation website. So the fourth nutrient food nutrient that is really problematic, I suppose, for Irish men is saturated fat. And we know that saturated fat is the main contributor to total cholesterol and to the bad component of that total cholesterol, which is the low density lipoprotein cholesterol. And we know that too high levels of total cholesterol are low density, the bad cholesterol, low density lipoprotein cholesterol in our blood can contribute to cardiovascular disease or cardiovascular events. And this has again been shown in a really large meta-analysis, so a big review that has taken lots and lots of different studies and looked at them all together, that was published in 2020. We know that less than 10% of our daily dietary energy should come from saturated fat, but at the moment about 14% of total daily energy in Ireland comes from saturated fat. So again, I suppose the recommendations are very much around reducing the pre-prepared, the fast meals, trying to replace those with lean meats, lean poultry, removing visible fat, removing skin, reducing, the cakes, the biscuits, the confectionery, and trying to replace those with eating healthy fats, fish, vegetable proteins, oils, nuts and seeds, small amounts of lean meat, small amounts of, chicken, fish, and then try to have dishes that incorporate more of the vegetable protein. So we're not saying that you should avoid meat or that you should avoid chicken, but that you should try and use more fish. You should try and use maybe smaller amounts of lean meat and try and also incorporate into maybe mixed meals with peas, beans, lentils, potatoes, carrots, celery, vegetables, all of the seasonal vegetables, and as many as is possible. So cardiovascular disease, as we know, is a general term given for the disease of the heart or the blood vessels, and is the buildup of fatty deposits, and is the most common cause of disease, unfortunately, still in Ireland. And those modifiable risk factors, relate to smoking, high blood pressure, as I've mentioned. We can reduce salt intake, inactivity, which I'll talk about a little bit in a minute, obesity, type 2 diabetes, and excessive alcohol. Whereas some of the non-modifiable factors like your age, your ethnic origin, your family history, you can't change those, but you can modify things. I always remember years ago, a good few years ago, this GP saying to me, he was about in his mid-70s, that his father was a GP as well, very high stress job. He was in the same high stress job, but he said, my father smoked, drank, and ate like lots of fat, and he died at 47. But I just was a little bit careful. I didn't smoke. I drank in moderation. I ate, a good mixed diet, and I didn't gain too much weight and tried to be a bit physically active. And now I'm 75. So even though you have a strong family history, you can still, you can still make changes that don't, aren't overly restrictive on your lifestyle, but do give you many more years of life and healthy years of life, which is what we want. The other thing that is important, I suppose, is that a lot of men develop prostate cancer, and about 4,000 men in Ireland develop this each year. Now, there's a lot of other cancers, and I could have gone into a lot of different other cancers that occur, and that where men are more vulnerable than women. But prostate cancer, I suppose, is one of the most common ones. So about 4,000 men in Ireland develop prostate cancer each year. And again, the risk of prostate cancer can be reduced by having a healthy weight, a healthy diet, being physically active, and again, knowing your family history. And if you have a strong family history, taking steps early on in life to, I suppose, just put those strategies in place that help you to remain fit and active and healthy, as healthy as you can be over your lifetime. So really the key points are, and again, there's lots of resources there on the Irish Heart Foundation website and the Irish Cancer Society website. I should have put up my own professional body website here as well, the Irish Nutrition and Dietetic Institute website. So to consume 5 to 7 portions of fruit and vegetables daily, plenty of whole grains, try to engage in aerobic exercise at least 30 minutes 5 times a week, limiting salt and replacing it with spices and herbs, reducing the intake of saturated fat, so your pre-ready-made fast foods and foods that are high in drinks high in sugar, and trying to limit processed meat, and trying to replace that with the fresh meats, the fresh fish, the fresh chicken, and trying to, again, as I say, have it in mixed meals with plenty of vegetables, potatoes and pulses. And then to limit alcohol, choosing low-calorie minerals or 0% alcohol beverages, sometimes as well. So just to go on a little bit about male fertility, and just to talk to you a little bit about that, because that is an issue that has, I suppose, got people are more, there's more and more people experience infertility. So approximately 4 out of 10 Irish couples experience infertility. And when it comes to, I suppose, the male role in this is that about less than 15 million sperm and 1 ml of semen is considered low. And the main infertility issues relate to sperm, which may be low in numbers or not be as mobile as you'd want them to be, or look abnormal under the microscope. And again, like cardiovascular disease, there are some non-modifiable reasons which are hard to deal with, and there are a number of modifiable reasons. And those modifiable reasons include smoking, excessive alcohol consumption, overweight or obesity, infection, surgery of the testes, hormonal problems, and then there's genetic disorders and drugs and medication. So I suppose from the perspective of nutrition, there are several micronutrients that have had been researched for their role in male fertility. So I'll just talk you through those now. There are a lot of supplements out there that are sold to enhance fertility, and there's very dubious evidence for a lot of them, but certainly there is some evidence for zinc, selenium and vitamin C. So when we look at zinc as a micronutrient, we know that it's related to immune health as its key function. And having a healthy immune system is really important for reproductive function, whether you're male or female. We know that if people are deficient in zinc, that it can delay puberty in boys. Okay, and we know that having adequate zinc intake and adequate zinc biochemical status or blood status is needed to have normal sperm function and fertilization. And that low zinc status has been associated with low testosterone levels, poor sperm quality, and increased risk of male infertility. So the recommendations from EFSA, which is the European Food Safety Authority, is they have a range of recommendations depending on sort of the phytates in a person's diet. So that really relates to, I suppose, fruit and vegetables and whole grains. But the range is approximately 9.4 to 16.3 milligrams per day for men who are aged 18 to 64 years. So men who would be generally, I suppose, in where, you know, where you'd be thinking of having children, or where fertility is an issue, is important. And the main sources of zinc are meat, especially the darker meats. Okay, so red meat, and if it's poultry, you know, the leg of the poultry, the darker meat is important. Tuna is good. Dairy, nuts, legumes, and breakfast cereals are good sources of zinc. So again, just to pick a random figure here, you know, to achieve 10.6 milligrams of zinc, which is, I suppose, just a little bit more than the lower level of recommendation, you know, small portion of roast beef, so 75 grams, which is about the size of the palm of your hand, 35 grams of breakfast cereal, which is an average bowl of breakfast cereal, you know, half a cup of lentils. As I said, if we could mix lentils and peas and beans and lentils, they're all good sources of zinc. In with meat are really good. Greek yogurt, I think everyone really likes, is a good source. And then, you know, seeds, you know, which you can mix into porridge and are good for overall gut health, are also a really good source of zinc. When we look at selenium, again, this is an essential trace element necessary for normal sperm function, and deficiency decreases the production of some of the selenoproteins that may affect the morphology of sperm. And what is recommended is about 75 micrograms per day for men in this 19 to 64-year-old age group. And actually, one of the best sources is Brazil nuts, because a Brazil nut contains about 70 to 90 micrograms of selenium. So you can actually get your full daily requirement of selenium in one Brazil nut. Now, I'm not working for a Brazil nut company or anything like that, but it is a very good source. So 1 or 2 Brazil nuts in a day, you're really going to meet your selenium requirements. But other sources are tuna, or a large hard-boiled egg, your baked beans, your whole wheat bread, a little bit of roasted turkey, or you know, or some cottage cheese, are all really good sources. So again, you know, you're not having to eat different types of food. So all of the foods that are good for heart health, that are good for prostate cancer, are also those foods that contain zinc and contain selenium. And the other nutrient where quite a lot of work has been done, and we're around fertility and male fertility, is around vitamin C, which again is important for immune health. And low vitamin C is associated with agglutinated sperm. You know, so there is some information there that vitamin C supplementation may be helpful, but the recommendation in general is that 60 milligrams of vitamin C per day is sufficient. So we don't need to be taking mega doses of vitamin C. In fact, they can predispose to kidney stones. So the main source again are citrus fruits, so your oranges, your limes, lemons, grapefruit, berries, peppers, potatoes, again, a great source of vitamin C. So one medium-sized orange will actually give you your vitamin C requirements for the day. And in fact, because vitamin C is a water-soluble vitamin, when people take excess amounts of vitamin C, they actually excrete most of the excess in urine, which is really why that can contribute to the development of kidney stones. Kiwi fruit are a really good source. You know, any of your green vegetables, I mean, I put broccoli there, but you know, any of your green vegetables are a good source. And then red peppers, green peppers, again, good sources, and potatoes in the Irish diet. When we look at the supplements, there was a systematic review. So again, a big wide-ranging review that looked across the board at supplements that are being, I suppose, promoted for male fertility. And these supplements contained 90 different unique ingredients across the 17 most popular male fertility supplements. So this again was quite a recent publication, only in 2020. And those with the most evidence, as I said, are zinc, selenium, and vitamin C, and often in contrast to the most commonly added. Okay, so really, I suppose the key message on supplementation to support male fertility is that dietary supplements claiming to improve fertility should be used cautiously, and the most important thing is to focus on overall lifestyle and diet. So it's a bit like, I suppose, sports nutrition, where oftentimes supplementation is being promoted, but no matter how much supplementation you have, that will not overcome a poor diet and lack of physical activity. So the most important thing is that you have a good diet and are physically active. So the HSE makes recommendations around male fertility, so avoiding smoking and recreational drug intake, limiting alcohol. And again, the same sort of recommendation about fruit and veg, 3 dairy products, especially the lower fat ones, peas, beans, lentils, higher fiber foods, the healthy fats, maintaining a healthy body weight and doing regular exercise. So when we look at maintaining a healthy body weight, we know that being overweight and underweight are not helpful to overall health. So overweight is linked to cardiovascular disease, to stroke, to type 2 diabetes, whereas underweight is generally related to malnutrition, to osteoporosis, to a weakened immune system. And even though we know that females are at greater risk of osteoporosis, as men get older, they are also at an increasing risk. All right, so again, we know that, you know, in the general population, about a quarter of the population of males are obese, 23% there, and 40% are overweight. That obviously is less in the younger age group and then less in the older age group. But in the middle age groups there, obesity and overweight are really quite significant problems. So we really need to try and keep as fit and active and healthy as possible. The methods that have been used by people, by Irish men, and this is from the Healthy Ireland survey in 2022, show that taking more exercise, eating fewer calories, eating fewer sugar sweetened drinks and foods, and eating less fat are the main methods used. So all of those are absolutely perfectly good methods to try and reduce weight and to try and maintain a healthy body weight. We know that the benefits of exercise are enormous. So 30 minutes a day, 5 days a week is what the HSE recommends. And that we know that that combats lots of health conditions. If there was a medication that cost nothing and did as much as exercise, we'd all be taking it. So, you know, even if it's only a small amount of exercise every day, so divide it into 3 by 10 minute sessions, you know, once it's 5 days a week, that is really beneficial to health. It allows us to think more clearly. It helps us control weight, boosts energy, prevents and treats some of the mental health conditions, increases stamina and strength, makes us sleep better, and makes us just overall in general better mood. And again, you know, there's been quite a few systematic reviews around this and looking at depression, anxiety, and mental health. So, you know, all of those, you know, on very large numbers of individuals show that there's people who engage in physical activity suffer less from depression, from anxiety, and from depressive symptoms, you know, sleep better, are more relaxed, and have higher energy levels. So again, really to try and promote the 30 minutes, 5 days a week is really good. Alcohol, we know that Irish people are drinking too much. You know, we know that 1 in 5 Irish adults have increased the amount or frequency of alcohol they consume since the COVID pandemic. You know, we know that people are often trying to reduce the alcohol that they take. We know that men drink more than women. And I suppose what we should try and do is have less than 17 standard drinks spread out over the week. And a standard drink is really referred to as a small glass of wine or a glass or half a pint of beer, or 1 standard measure of spirits. So really 17 over the week with at least 2 alcohol-free days. Smoking, again, we know, unfortunately, that men are more likely to smoke than women. And we know that smokers report that health issues restrict their everyday activities. So it's a bit of a vicious cycle, really. If people are smoking, then they are less active. If they're less active, they're more inclined to smoke, they're more inclined to drink, they're more inclined to engage in unhealthy behaviors. So really, I suppose it's trying to take those little steps to try and reduce smoking initially or give it up completely if you can. Try and increase the physical activity, increase the healthy diet, and then try and take alcohol within the recommended amounts. So for men, as I said, 17 standard drinks per week. So I suppose the key messages then, really just to finish up, are really that we should try and have our saturated fat intake less than 10%. So that means that we should really try and have small portions of lean meat, fish, poultry, mixed in with pulses, beans, lentils, plenty of vegetables, plenty of rice, pasta, whole grain if possible, plenty of potatoes, are all is the healthy way of eating. That our alcohol consumption should be less than the 17 standard drinks per week. That salt should be less than 6 grams per day. All right, so that really means that we should only add small amounts of salt in cooking, and that we should try and avoid all of the processed and fast foods that contain a lot of salt to make them tasty, because oftentimes they contain maybe the less good or the cheaper cuts of meat. So they have a lot of salt added into them to make them taste better, but try and cook fresh in as much as possible using herbs, spices. If we want a curry or an Indian or a like a Chinese, to try and use maybe more spices rather than salt. The dietary fiber should be more than 25 grams per day. So again, that's focusing on the whole grain cereals, the whole grain breads, that we should take a vitamin D supplement for all adult men up to the age of 64, of 10 micrograms per day between October and March. And actually for older men, it should be 15 micrograms for the whole of the year. And that we should try and have 30 minutes of exercise at least 5 times a week. And starting off, even if that is only in 3 10-minute sessions, that is perfectly fine. I just want to call attention to the fact again that it's Men's Health Week this week, and the whole focus of Men's Health Week is what's your picture of health. So again, but to come back to those images that I showed you at the beginning, the picture of health is like that every one of the men that we know, whether they're our fathers, our husbands, our sons, our brothers, our uncles, come in different shapes and sizes, and our picture of health should be of somebody who has a healthy weight, eats a healthy diet, it takes at least 30 minutes of exercise 5 times a week, and has good mental health. The Men's International Health Week this week is in collaboration with the HSC, and you can see there the HSC encourages men to set simple, realistic and practical tasks to improve their health as Men's Week. So again, there's quite a lot of information there if you look on the HSC website. And then just to have a shout out for the Irish Men's Sheds Association, who are work in every single county, every single town in this country, really to support men's mental health, men's physical health, and trying to put men in touch with each other to have as healthy a lifestyle as possible. So I just finally want to thank Aoife Courtney, who helped me put this together, Aisling Cunningham and Kellyanne McLaughlin, who are placement students with us from Technological University of Athlone, and Aoife, who is doing a PhD, who's a qualified dietitian and is doing a PhD currently with Professor Lorraine Brennan. So thank you very much to the 3 of them for helping me put this presentation together. And I've just left in my references there because we can put this up onto the Institute of Food and Health website, and you can look up the links yourselves if you wish to do so, and find some of the useful information, get a little bit more depth of information there than I can cover in about 30-35 minutes. All right, so I'll finish up there if that's okay.
Thank you very much, Claire. That was a fantastic overview of some of the key and pertinent points from a nutrition perspective for men's health. So now we're going to have a Q&A session. So if you have questions, I'd encourage you to put them into the Q&A box at the bottom of the Zoom tab, and we will